Talking all things teeth, and we're talking about oral health with dentist Dr. Aman Bharti, who is with us now. Aman, hello. Good morning.
Good morning.
Thank you so much for joining us. It's good to have you with us.
It's a pleasure. Thank you for having me, and it's breaking up my lockdown experience.
Oh, I was just going to ask you, what is your current experience? You're not working then?
Not working. So this for me is now day 5. I closed the doors of my practice on Monday. Haven't been working since. Just running an emergency service remotely from home, really. That's what all the dentists are doing nationwide.
Right, I'll come to that in just a second. But is that the case then? I know I had an email from my dentist saying that they weren't doing any appointments. Is that how it is then across Britain at the moment?
Absolutely. So obviously we are a united kingdom. So there are 4 nations, aren't there? There's England, Wales, Scotland, Northern Ireland. So we all have our own advisors and governing bodies. There is obviously a central NHS, but there was different advice coming out from each nation slowly. But it wasn't until Wednesday of this week that the Chief Dental Officer of England actually ordered the closure of all dental practices across England. So I was proactively closing on Monday because I could see it coming. But yes, as of Wednesday, all dental practices were to shut in England.
It just shows, doesn't it, Aman, how we're very much sort of feeling our way on this one. Because when you think about it, of course, dentistry, it's very close physical stuff, so you wouldn't be able to keep your distance or keep the 6 feet or 2 meters away from people. So it's quite logical, really, isn't it, that this was going to happen?
Well, absolutely. I'll just explain to the listeners why dentistry is such a high-risk, area, high-risk profession. So when you come in for dental treatment, say, for instance, if you're having a filling or if you are having, say, your teeth cleaned by a hygienist, it generates something called aerosol. So these are called AGPs, aerosol-generating procedures. So just imagine you are sat there in your room right now with a can of deodorant and you spray it into the air. That is what's happening when you are having some dental treatment. Now, this aerosol, if you are a carrier of this virus, it will go up into the air and it will stay in the air, stay in that room for about 4 hours. So that means that if you are a carrier of the virus, the dentist will get it, the nurse will get it, and probably all the people which are walking to the surgery for the next 4 hours are going to get it. So that's why, during this critical period where the virus is spreading exponentially, we really need to reduce the amount of people which are in contact with this, which is why we were ordered to shut the dental practice as of Wednesday.
I'm going to take questions. If people would like to get in touch to ask you anything about dentistry and oral health and what we should do, they can give us a text. Drop us a text now, 81333. Start the text with the word Leeds, or you can give us a ring, 0800 389 3333. We're talking to dentist Dr. Aman Bharti. And one of the things I will be asking you about shortly is emergency treatment, what people should do if they need that, because presumably that is still continuing.
Absolutely. As you correctly said just a few moments ago, we're still feeling our way through this. We have never, ever, ever come across anything like this before. So currently it's not actually in place yet, but the NHS nationwide is setting up emergency dental centres. So if you physically have to see a dentist, you won't currently be able to go into your dental practice. You have to ring your dental practice. So the phones are still being manned, most likely remotely. And then, if we can manage your dental emergency over the phone, so not every single dental emergency has to have a face-to-face meeting. So if we can manage your dental emergency over the phone or over FaceTime or over Skype, which is the service I'm offering to my patients, then, we try and manage it as conservatively as possible until we're back up and running again to be able to see you face-to-face. Currently, and this is changing rapidly, it's going to change over the next couple of days, but currently they are setting up the acute dental centres across the country. So if you if we cannot treat you, face to face, if you physically have to see a dentist over the next few days, we will be able to tell you where to go. But currently, unfortunately, you just have to sit it out for the next couple of days. So it's a very, very strange and frustrating situation, but one that we've never come across before. Absolutely.
help us out with any problems that we might have. Aman, Eileen in Elland has given us a ring. She says she recently had a 40-minute drilling session, a temporary filling before the restrictions were in place. Her next appointment was due on the 7th of April. All these appointments have now been cancelled as per government advice. It's a deep hole that she's got in her tooth. She's lost half the filling, she says, and Eileen is very worried that she's going to have really bad toothache. That's what I was going to ask you about. This is somebody who's clearly in the middle of treatment. What should Eileen do?
Eileen, thank you for your question. There are literally hundreds of thousands of people in your position right now. There's a couple of things you can do. First of all, if it's not hurting, that's great. The temporary filling is still probably sealing that cavity. However, you can get temporary filling kits from Boots. So if you can just nip along to, Boots or any other drugstore,
other chemists are available.
Other chemists are available indeed. Sorry,
not at all.
You can get temporary filling kits, and you can probably just top it up. But if
it's probably best to do that before it starts hurting, isn't it?
Yeah, definitely. I mean, if you can top it up and keep it filled up to the top, then that's obviously going to, keep it cleaner, and then there's less chance of you getting problems. But if it's not causing you any pain, then currently you don't need to do anything. It's not classified as a dental emergency at the moment. So just sit on it and top it up if you can.
Right. Okay. So it's sort of, you can sort of handle it a little bit yourself.
Yeah.
Anne in Batley. Morning, Anne. I hope that helps, by the way, Eileen. I hope that helps you. Maybe that's an essential trip to your local chemist or pharmacy, as we now call them, is in order, Eileen. I hope you're all right. Anne in Batley, the virus tests that now seem to be happening to NHS staff, do they include dentists being tested, do you think?
Well, if I can just very, very quickly explain what's actually happening to dentists, because dentists have been forced to shut the practices. The majority of dental practices in the UK are actually NHS dentists, so they've got NHS dental contracts. So dentists have actually been requested to move to the front line. So these emergency dental centres, which I was talking about, are going to be manned by dentists. But then there's many, many dentists who have skills which are transferable to a hospital setting, such as, administering IV drugs, taking blood pressures, so on and so forth. So dentists will actually be working on the wards of hospitals and then these new hospitals which are currently being set up as well. So, yes, if dentists are working on the front line, they will be tested indeed.
Can I ask a very basic question then?
Please
what should you do if you wake up in the morning and you've got toothache? What can you do?
Well, fantastic question. The first port of call is still your dental surgery. So the dentist that you normally go to, ring your dentist. We call it the 3 A's. It's advice, analgesia, which is painkillers, and antimicrobials, which is like antibiotics. So, a lot of stuff, there's practical advice as to how we can help you if you have toothache. It can probably be managed if it's mild, just with normal painkillers. It might be toothache due to an infection, so you might have a bit of a swelling or a tooth might be dying off. A dentist will be able to assess that for you, in which case you might just need a course of antibiotics. Dentists are liaising with their local chemists, and sometimes dentists actually have a stocking clinic to be able to dispense to you to be able to treat that toothache. So, the first port of call is still call your dental surgery, and then, we can advise remotely. And it's important that you do that, because you don't want to be ringing 111 straight away, because that service is going to be overburdened with not just dental emergencies, but all emergencies. So, that is the first thing you need to do.
Going on. And today we are talking all things teeth and oral health with dentist Dr. Aman Bharti, who is with us now. Aman, hello. Thank you very much for staying with us. You've told us a little bit about what the situation is with the dental service at the moment, and we've talked about what to do if you get toothache. Tell us again a little bit about what counts as an emergency, and if you do have what you think is a dental emergency, what you should do.
Okay, so specifically now, what an emergency is if you have a swelling which is causing you a fever, if you have uncontrollable raging toothache, And that at the moment is pretty much it. I should actually add to that. If you have a broken tooth, which the nerve is exposed and the toothache is uncontrollable, that is pretty much it at the moment. That's as far as your teeth are concerned. If you have an uncontrollable bleed, so for instance, if you've had a tooth out recently and the bleeding isn't stopping, then you need to see somebody. However, I doubt anybody has had a tooth out over the last few days, so that shouldn't really be a problem at the moment. But it's very, very limited as to what a true emergency is at the moment. So what a lot of people would normally classify as a dental emergency at this moment in time doesn't actually count as a dental emergency. For instance, like a lost temporary filling. If it's not causing pain, it's not an emergency. Even something what I would normally classify as an emergency, a dire emergency, say, losing a front tooth, that affects you socially, it affects your appearance. But right now, at this moment in time, that is not actually an emergency because we just really need to get on top of this virus.
But if you have something that you think is an emergency, my instinct now from talking to you would be to go to A&E, and I bet that's wrong.
No, absolutely. No, the first thing you need to do is call your dental practice that you normally attend.
Right, so call your dentist. Even if you've been notified that it's shut, ring the number. And will they have an emergency number?
Yes, every dental practice has been ordered to shut. However, every dental practice has been ordered to have emergency provisions in place. So every practice will have an emergency line that you can contact. Either the calls have been rediverted or they've set up an emergency mobile phone number. So you will be able to speak to your dentist most likely in most situations. As I said before, most situations, toothache doesn't necessarily mean they actually need treatment on the tooth. A lot of toothache can actually be treated with either painkillers or antibiotic medication, and that can be delivered to you. A lot of dental practices are liaising with their chemists to be able to get these drugs delivered to you, or you can pick up the drugs from your local chemist.
Oh, that's interesting. So you could perhaps then ring the emergency number, talk to your dentist, talk it through, and if your dentist thought that antibiotics might be the answer, you could actually access them sort of almost remotely. That's really interesting.
Absolutely, yes. So we are liaising with our local pharmacist, and we can remotely give them prescriptions for the patients, and then the patients can actually go and pick them up from the chemist. We are a private practice in Leeds City Centre, so geographically depending, I actually have a stock myself, which I am actually delivering to patients. I've delivered one this week if they have a swelling, and so not everything needs a face-to-face attendance.
Right.
Not everything needs to go to A&E, and it's very important that people don't actually do that because they are overburdened as it is, especially with new cases of COVID-19 coming in.
So this is all worst-case scenario stuff, Dr. Aman Bharti, but what should we be doing then? Because obviously if we can prevent this sort of thing happening, if we can preserve good oral health, that's probably the way forward, isn't it? So is there anything extra we should be doing, or is it just a case of, brushing your teeth as normal?
Well, no, that's a really, really good question, actually. So we are all going to be at home now for an extended period of time. So it's really important that everybody brushes their teeth twice a day with a good fluoride toothpaste. If you don't already, you need to clean in between your teeth, so using floss or interdental brushes. And it's very, very, very important that we all look after our diet. So because we're all going to be at home, I know I've been guilty of it. We're all picking up food from the fridge.
Oh, we're all snacking, aren't we?
We're all snacking. So, sugar, reducing the amount of sugar intake that we have at home. So, limit your sugar to 3 times a day. That's with your meals. It's when we're snacking in between with sweet things that contain sugar, fizzy drinks,
Oh, that's a good little rule.
Yeah.
3 times a day with your meals. That's good. I might write that on a note and put it on the fridge.
Yeah, that's what we normally say. If you can limit it to meal times and meal times only, that's going to minimize the effect that sugar has on your teeth. But if you're constantly snacking on sugary items, that's when people start to experience cavities and tooth decay. If I might just add, if you do have a dental emergency, we are just feeling our way through this at the moment.
Yeah.
The NHS is currently setting up these clinics, so this is going to change over the next few days. There will be face-to-face help available in the next probably couple of days. I know colleagues which are currently being asked to work in these new centres which are being set up. So help is coming. Just over the next couple of days. Just sit on it, and we'll be able to help you very shortly.
It's been really useful, practical, interesting information from you this morning, Dr. Aman Bharti. Thank you so much for joining us, and perhaps you'll come back again in the days and weeks hence.
Yeah, no, definitely. So thank you for having us, and it's been a pleasure to speak.